Patients with intellectual and developmental disabilities, commonly referred to as IDD, have unique needs that require specialized support during medical visits. Many individuals with IDD face challenges with communication, sensory processing, and adapting to new environments. A busy hospital setting with unfamiliar faces, sounds, and routines can increase anxiety and make it harder to deliver effective care. Cooper University Healthcare has taken steps to provide sensory-friendly spaces for these patients, but providers can also help make these patients feel welcome and safe by making reasonable clinical accommodations for patient comfort. IDD patients may not tolerate standard clinical procedures like blood tests, mammograms, or MRIs. In these cases, providers can consider alternatives that still provide beneficial information. For example, if a patient cannot tolerate a mammogram, an ultrasound may be an option. While not meeting the typical standard of care, it may provide essential insights and is preferable to foregoing screening altogether. Alternatively, when sedation is required for a procedure, this can be an ideal time to schedule additional tests or procedures that may otherwise be challenging for the patient to undergo without sedation.
My name is Jennifer Brown. I have a 27-year-old son with a rare genetic disorder called Phelan-McDermott syndrome. So the first challenge that we faced was actually getting the specialist to accept him as a patient, getting him in that environment and asking him to wait an hour or two sometimes. By the time we would get to the appointment and to see the doctor, he's bouncing off the walls and, the comments are, can't you control him? And, this is why we can't see him. And, we need to find you a different specialist. I've had doctors tell me, well, it's too bad he has to learn. He's not always going to have these accommodations, and so he has to learn how to behave. Our local hospital, I've asked them for some changes, and it's very slow. And to see Cooper kind of grab it and go, makes me want to move a little bit. When we have an appointment and the doctor talks directly to my son, it's incredible. Just that act of kindness, that act of understanding of there's more going on here than just his, gastrointestinal tract, and how am I going to get the best out of him? And how can I make him the most comfortable? And this idea of a holistic approach around the person, around who they are and what they need is very helpful.
My daughter was treated at a children's hospital, and when she aged out of that hospital, it was very difficult to transition into adult care. Oftentimes, when we saw practitioners who weren't used to treating adults with IDD, they would offer tests that simply, they weren't realistic as far as the patient being able to tolerate the tests, and they didn't understand that often the results of those tests are going to rely on the caregivers making sure that the tests happen and it happens appropriately. So a group of moms got together and decided that we wanted better advocacy for our family members, our loved ones who had IDD. We came to Cooper and we presented to them that we felt Cooper could do a better job treating our loved ones. And we were lucky enough to have individuals at Cooper that listened to us. One of the things that we really impressed upon in our meetings is how important it was for practitioners to stop and listen to family members or self-advocates and understand why a certain test may be great for somebody who is neurotypical, but it's an unreasonable request for somebody who's not. So just by stopping and asking a couple of questions, finding out who the decision maker is, and also to find out a little bit about past history, what has worked positively in the past, what hasn't worked so well, and not feeling as though they have to reinvent the wheel. One of the things that's made an enormous impact is everybody seems to be on the same page. When you walk into an office now and your loved one is part of the IDD registry, everybody in that office knows this person has a disability. They understand that they may not be able to wait in the waiting room, or that they may not want the exam door closed right away, or that they may need sensory tools. And whether your individual or loved one is verbal or uses sign language or may use an augmentative device, practitioners and people at Cooper are now listening. That has really made an enormous impact overall in this population. Cooper has gone out of their way to find out how they can make the world a better place for those with IDD.
By creating a supportive and adaptable environment, healthcare providers can ensure a smoother, more positive hospital experience for IDD patients. With a sensitive, individualized approach, IDD patients can receive care that respects their dignity and meets their health needs.